really.
All right, so this is Crystal, and she's just a little bit pregnant. And how many weeks are you now?
32.
32?
Mm-hmm.
So she's 32 weeks pregnant, and she's complaining of like right hip pain that kind of radiates down into about the mid-thigh, and some right arm and shoulder pain. She's been a patient of ours for probably, 2 years, 3 years? Right around there. So we're gonna see if we can get her feeling a little bit better. The primary reason why we're doing the video today is there's so many people out there that are afraid to go see chiropractors because they've either heard bad things about chiropractic or they're really just not for sure of what we do. So I'm going to show you a little bit of what we do with her, and if it's safe for a girl that's 32 weeks pregnant, then it's probably safe for you to come in to see us as well. So the first thing I'm looking at is her leg lengths, and you see that her right leg is a little bit shorter than the left leg, not a lot. And if we look at her right butt cheek here, you can see this is much higher than the left side. So we're going to see if we can level some of this out for her a little bit. We're going to use this table. It has drops on it. So when I go to adjust the joints, we're going to let the table do the work, and you'll feel the table drop down. It makes a little bit of noise, but it's only dropping maybe half an inch. So it makes more noise than it actually does anything. So with Crystal, her left ilium is kind of rotated backwards, so we're going to rotate it forward. And then her tailbone, or her sacrum, is kind of rotated backwards on the right. So adjust that. That's pretty sore right there. Isn't it? So this is L5. And when you're pregnant, you're carrying that extra weight in front of you. Your center of gravity changes, and you end up getting a lot of pressure here in the lower part of the back. Anyone that's been pregnant can definitely attest to that. And we're going to strap her in a little bit. This is a technique called coxflexion. And what we're doing is we're just using this to kind of stretch the muscles out in the lower part of the back, open up the holes that the nerves come out of, and kind of rehydrate some of the disc a little bit. This table was originally designed for people with like a herniated or a bulging disc. So right there. Looser, isn't it?
Mm-hmm.
Now, leg lengths are nice and even. Take a little breath in. Let it out. This one right here. A little breath in. Let it out. And let's have you turn over on your back for me. Straighten this around here a little bit. And let's have you go ahead and lay back on your back for me. Good. Bring your legs down. So since Crystal's pregnant, we're going to check the front of her pelvis. Make sure it's lined up and moving the way it's supposed to. You can see as we rotate our legs in, the right leg doesn't rotate in as far as the left leg. So we're going to check the pubic bone here in the front. There's a little joint in the front. And you can see how the pelvis definitely is not level. Can you feel that? How uneven that is? So I'm going to adjust this. This is pretty common, pretty typical with a lady here that's pregnant. Yeah, they're nice and even again. Feel the difference? Sore right there. So there's several ways to adjust the neck. We're going to adjust it by hand today, just because people are afraid to have their necks adjusted. So I just want them to see how easy and how gentle it really is to get this done. There are several ways to do it. They're even more gentle. Let your head drop to the right a little bit. Things for you like Brian. Let's do a little bit on this shoulder. Yeah, try to drop a little bit. How's it feel?
Feels good.
A little looser, a little better.